My name is Stephanie Barrientos.
I'm Kay McDonald.
And I'm Heather Waldschmidt, and we are all second-year master's students at Texas Lutheran University. Today, we're going to be going over different articles about centrosine and how it affects urticaria. So the first one talked about centrosine and using the supplement of ranitidine in chronic urticaria. And so with that, they did two different groups, one with just centrosine and then one with the added ranitidine, which is another supplement that helps with antihistamine effects. And so their definition of safety here was looking at the presence of other adverse effects from the medication. And they also looked at the efficacy. So they used the Urticaria Activity Score, the Chronic Urticaria Quality of Life Questionnaire, and the VAS scale for pain. Their results showed a remission of urticaria in both the placebo group and the addition of ranitidine, but did not find any more effectiveness with the addition of ranitidine than in just the centrosine group. But they both had a return of urticaria after completing the trial and stopping the medication. So what this application shows for athletic trainers is that the centrosine on its own is effective. We don't need to be concerned with our athletes needing another additive supplement to that medication, that if we just recommend centrosine to them, if they have allergies and they're not already taking something, then that can be beneficial for them, and we don't need to go through extra steps to get more medication for them.
My article is double dose of centrosine hydrochloride is effective for patients with urticaria resistance, a prospective randomized non-blinded comparative clinical study and assessment of quality of life. So for this study, they wanted to examine the efficacy and the safety of implementing an increased dose of centrosine for urticaria resistance in patients. They wanted to compare this to replacement of the centrosine with olopapidine, which is similar to centrosine in its effects. Initially, there was 59 participants at the beginning of the study, and the whole study overall lasted approximately 7 months. There were 2 periods within the study. Period A, all the patients received 10 milligrams of the centrosine over a 1-week period once a day. At the end of that period A, all the participants that still had urticaria symptoms were put into period B. And then once put into period B, they were separated into 2 groups. One group receiving double the dose of centrosine, so 20 milligrams once a day. And then the other group received olopatadine for 5 milligrams twice a day. They based it off the physician-based 4-point scale of the urticaria symptoms. So a physician would examine them and base their symptoms on the scale. The participants used the visual analogy scale to base their itchiness both during the day and at night. They used the quality of life scale of the Skindex 16 as seen on the screen. And then they used a 4-point end of treatment scale just to examine how the urticaria was at the end of the treatment. At the end, there was only 16 participants because some were canceled out using from period A to period B, and then some jumped out and some had adverse effects, so they were eliminated from the test. At the end, there was no statistical or significant difference between the 2 groups. However, the centrosine group actually showed a decrease in the physician-based point scale, and 81.3% had remission from urticaria resistance, and then the VAS scores showed improvements with nocturnal itching, and then the Skindex scores correlated to that nocturnal itching. So overall, there was the increasing the dose of the centrosine to help decrease urticaria resistance in patients showed to be effective both and safe. As athletic trainers, we can talk to physicians about maybe using this as a form of helping our patients who are having urticaria symptoms for a period longer than 1 week. So.
All right, and then my article is called The Treatment of it's over the treatment of chronic urticaria with antihistamines. It goes over like the same antihistamines. So the citrazine is what we've been talking about. That's like the main one that I like to focus on. And it's basically seeing if that double dose is like a reliable treatment or if it should even be done. And so basically with this article, they've looked at several different studies and then with different medicines and come up with the conclusions for each one, if it's worth doing the double dose or what dose is best for each medicine. So with the citrazine, they come up with the double dose being the best treatment method. They said it was a highly effective with this certain form of urticaria. And for this next one, they basically decided that the 60 milligram dose was the best one for that treatment. And if they went higher, it either had too many adverse effects or it had the same effect as the 60 milligram dose. And then down here, basically it says that it is okay to give them the double dose for the most part, based off of the research that they had found. And yeah, so basically we just need to talk to our team physicians, make sure that they are okay with that, and then kind of make our judgment based off of the medicines that we have to administer to our patients.